I'm just getting started. The first part of the road is the hardest. You try all you can, but you don't get far. But you're on a long journey to becoming a star. I'm just getting started. Just getting started. Fate plays your strings like a violin. Watches what you do and watches your sin. You take a wrong turning and all hell breaks loose. If you fuck it all up, well, you cooked your goose. Look out for the rules, 'cause it's a big game. There's more to this game than fucking dead. I'm just getting started. Just getting started. And you know my name.
Hello? Mr. Hines?
Oh yes, yeah. Good afternoon. I really do need to speak to someone, please, about Coviditis and about
Yes,
Lockdownitis.
I'm Dr. Hill, and my receptionist spoke to a minute or two ago and said that you were thinking you were having problems with Lockdownitis and also possibly, I believe, Coviddepression. Is that correct?
Yes, I think this. Coviditis is leading to is increasing my already paranoid OCD.
Paranoid OCD. Is it? Right. Okay, I understand totally. I'm getting lots of calls like this from people in the general public who actually are suspecting they're developing severe Coviditis, and quite a few people are also going on to develop Coviddepression, which is a different thing. And there's also Lockdownitis, which is another condition that is developing very frequently with many members of the public, because unfortunately they're spending a great deal of time watching the television, and the BBC News in particular, and getting very distressed about it. Are you finding you're developing some distress? And if so, what sort of symptoms are you getting?
So I was wondering, Doctor.
I
can't stop moving things around in my room. Nothing's ever in the right place.
So
and I had that before.
Some other symptoms which psychiatrists might describe as OCD.
I know, and when I'm walking, yes, that's right. I was going to ask you, Doctor. I do trust you very much. Is paranoia
one of the symptoms of
Lockdownitis or Coviditis?
Well, people start off with very mild anxiety, and then a week or two after the first symptoms develop. If they are walking in the street, following the exercise regime recommended by the government, they will find that they put on dark glasses on dark days, and when people walk towards them, they will stagger across the road to the other side of the road and avoid eye contact with the human being coming the other way, who often may be a doctor or someone like that. But it's a fear of other people because of the possibility that they will breathe in your face and send huge spiky balls down your throat. Is that a fear you've got?
Yes, and these spiky balls seem to be floating around the front door. Coupled with the paranoia about going out of my front door.
And the fact that how many people might actually notice
as I come out of my front door, how many people are watching and analysing me as I go out of my front door, how many of them are
asking questions about where I'm going,
asking questions about where I'm going,
what time I need to be
what
back,
time I need to be back,
and whether I'm going to work,
and whether I'm going to work, or whether I'm a key worker, or whether it's permitted daily exercise. Are those the things they're really thinking, my neighbours?
Is that all
Doctor,
in my
or is
head?
that
I mean,
all
I've been
in my
listening to what the
head?
government have
I mean,
been
I've been
saying.
listening to what the government have been saying.
Well, do you notice people, a little bit away from your front door, and they look at you furtively when you look at them out of the window? Do you have that sort of feeling occur?
Well, they try to pretend they're not looking, but I think they're analysing everyone's
situation, all of the neighbours.
Do you sometimes see them pick up a mobile phone and make a phone call, and you assume you're being reported to the authorities? Is that a thing that happens to you?
That's something that's been at the back of my mind as well. And that's why I've kept the curtains drawn, we're not really supposed to. I mean, the government, who we have to obviously trust, the government have got our best interests at heart. The BBC are telling us that the government
we
should keep the curtains drawn now. I mean,
are you keeping your curtains drawn, Doctor?
As a doctor, I have been following the medical advice and opening the windows and letting howling gales in to blow any spiky balls back out into the the main area outside where they'll die. And I would recommend that as one of the things you could do to start to reassure yourself that actually your house isn't filling with spiky balls that have been sent to you by your neighbours, which is a thing that people have said to me in the past. They've had a feeling that their neighbours are blowing spiky balls through the letterboxes.
But the French lady, the French lady down the road,
the French lady down the road, who works in my local mini
she said
store, she said
that the spiky
the plastic visor was useless, Doctor, because those spiky balls can come up underneath the gap underneath the visor and just go straight up into my face, and goodness knows where. I mean, would you agree with that argument,
Doctor?
Doctor?
You developed a bit of a fear of spiky balls crawling up the inside of your visor.
Yes.
Is that right?
Yes. I think it's paranoia, Doctor.
Yeah, and I think it's paranoia, Doctor.
It undoubtedly is an increasing degree of paranoia, and I have had 5,000 patients in the last 2 weeks come along.
Sorry, every now and again.
Every now and again I have to do that.
To me or ring me with similar type of symptoms, which are not obviously recognised medical symptoms, but seem to be related to this COVID-19 virus, which personally, from dealing with people, I have found displays exactly the same symptoms as influenza. But in fact, it is COVID-19. And the reason we know it's COVID-19 is because, well, we've heard from the government what COVID-19 is, and we assume it is. I mean, there are tests that you can do, but many people coming in here as patients, we have to make a spontaneous diagnosis based on the government's authority. And so, to be honest, I don't know whether it is COVID-19 or whether it's influenza. I know that we have had a remarkably small number of people this year developing influenza, but a lot of people with COVID-19. And it may be, of course, there's a connection between the lack of influenza and the amount of COVID-19, but one can't be sure. So what are the symptoms again? One of the symptoms that some people have had is they find themselves spontaneously becoming flatulent. Have you had that?
Well, this is it. Yes, the
breaking wind and the
situation. Normally, I keep that to my own. The privacy of my own home. But recently, now it's been happening. It's
been happening in the pharmacy.
Even with a mask,
so I feel. Do I need a mask
on that part of the anatomy as well?
On that part of the anatomy as well.
That part of the anatomy is a good idea because it will stifle the sound. That's the first thing. And of course, the reason why people are feeling a need to flatulate in public is because most people are finding it very difficult to speak to people. So this becomes the new method of speaking. Have you found yourself holding conversations with people where you flatulated, they flatulated in a different way, then a lady's come in and flatulated in a female way? Have those things happened to you? And there's been no conversation going on.
Yes. And coupled with my fear of these
COVID
spiky,
colourful
not actually
COVID balls,
colliding
not actually
with the visor,
colliding
but actually going
with the visor, but actually going underneath it as well, up into my face.
Have you actually seen them crawling up the inside? Because
I think I have. I think I've
seen
various
coloured
colours. I think
various different colours. I think I've seen.
And I trust you entirely.
And I trust you entirely with these disturbing thoughts I've been having.
Also, one of the things when the spiky ball crawls underneath, it often turns into some sort of arachnid. What sort of arachnids have you seen the modifying into inside the visor as they crawl towards your face and when your eyes bulge out in panic?
Well, I think it's when I look down at the floor.
Well, I think it's when I look down at the floor in a shop and I look down at the arrow. The arrows on the floor.
And that's when I start to go into panic.
And that's when I start to go into panic. And yet that's when I start to see those type of things that you just mentioned.
They go from being balls.
And so they go from being balls into actually
from spiky balls into
actually being
alive and having eyes,
and legs.
It's like they're
mutating into
actual creatures with evil souls.
With evil souls.
I can understand that totally. Do you notice that before they go from the outside of the visor and crawl inside, do you notice them mutating into an arachnid? A common thing I've been told by people I've spoken to is they seem to mutate into something that's a bit of a black widow arachnid. Do you see black widows? And the other thing is, do you also experience auditory hallucinations where they seem to be muttering away quietly underneath there, and often with a bit of gnashing of teeth? Do you also see that?
Yes, and sometimes but most
of them are pink, though, Doctor.
Yeah.
That's an unusual.
But they're exactly as you
describe.
So I have even more faith in you than I had before,
Doctor.
Yes, but why hasn't this been covered on the BBC?
But why hasn't this been covered on the BBC, Doctor?
I understand. Okay. So what you want me to do is to help you to deal with the symptoms and become a little bit more relaxed and placid. Is that absolutely correct?
You have hit the nail on the head. I need to be able to go out of my front door. And at least be able to walk. Without all these eyes analysing my every footstep.
Yeah. I understand totally, Mr. Hines.
Thank you.
You are very frightened, and you need to take something in order to alleviate the stress. I'd like to recommend 2 prescriptions for you that you can come in and collect from the surgery. In a few hours' time, I'll sign them for you, and you can go and take them to the pharmacist, who will give you the massive pills. The first one I'd recommend is that I issue with you for a prescription for a very large, I've forgotten the word, what is it? Thing you put up your bottom. What are they called? I don't remember. But anyway, they're a diacalm that is a thing that will stop the spontaneous flatulation, and then you'll find that you'll be able to speak to people, because when the flatulation is going on, it is difficult to also speak. So what they are, I remember the word, a suppository, a large suppository. If you will put 2 of them up your bottom once a day, that will alleviate the symptoms of flatulation and the tendency for the flatulation to develop a life of its own and speak to the flatulations of other people.
Our staff protected by their screens from my flatulations?
Yes.
From my flatulation?
Yes.
Do you think they're adequately protected by their screens from my...
Yes, they will, because, you see, if you take the suppository and shove it up your bottom, 2 of them, as I say, and they're quite large, probably quite pleasurable in a way to put up there, then what that'll do, that will quite quickly stop the associated solids coming out with the flatulations by making them a little bit firmer, and then the flatulations will stop. You will find that when you're in a group of people, you will find it easy to speak normally to them rather than speak through the flatulations. And the second thing I'd like to prescribe you is quite a large dose of cocaine, because that will give you a bit of an oomph, and the oomph will make you feel more empowered and less fearful. Well, so would that be okay? I mean, that isn't something that the NHS
the things you're saying, the things you're saying, Doctor, I do trust you, but might I say, the things you're saying sound terribly inappropriate.
Well, no, not really, because that's what the cocaine will do. If you sniff a little bit of it up your nose, what it'll do, it'll stimulate you and make you feel more alive. Because you'll feel more alive, you'll feel more confident. As I say, the cocaine isn't something that the NHS will prescribe, but I do know somebody at the other end of where you live, where you could go to them with a prescription, and the prescription will therefore mean it's paid for. It's quite expensive drug, not generally used by the NHS, but I found it to be very effective in dealing with the symptoms of either Coviditis or CovidDepression or Lockdownitis.
Should I tell you? I'll tell you what pushed me over the edge before we. Because I know you're very busy at the moment, so we'll have to wrap up.
I'm incredibly busy. I've got another 1,000 patients to see today.
Right. Well,
which have got similar symptoms.
I saw a lady in the local store the other day, and she was when she was cleaning the floor, she was actually polishing the arrow stickers on the floor. And when I saw that, it made me even more paranoid. She was polishing them to give them a shine.
People who come to see me who work in supermarkets and have to do the cleaning.
Yes, and they're polishing they're polishing the arrows.
Yes, they are. Yeah. So does that help you, Mr. Hines? Will you be able to come and get the prescription a little bit later today?
Well, thank you so much, and I'll keep you updated, Dr.
And I'll put on the bottom of the prescription the address of the house. It's a little bit of a rough house, but you can go round there, and a black gentleman will hand you the prescription of the cocaine, and I suggest snorting it up your left nostril is the most effective way to get it to your brain.
And what are the right? Oh, wonderful, thank you. And what are the guidelines that I need to adhere to when I'm going there to pick up my medication?
Well, what I would suggest is when you go to the pharmacy, there's no issue at all, except you need to be wearing a very large and obviously furry black mask. It's important it's furry because furry is less intimidating than the masks that people wear without fur. And it's obviously important to present in the pharmacy in a way that suggests that you're friendly. Otherwise, I'll be getting a phone call from the pharmacist saying that you came in there and they'll be developing symptoms of Lockdownitis too. When you go to the house in the address that I give you, as I say, don't get into any sort of discussion with the black person who will answer the door and will give you a small envelope full of the cocaine. And I think when you get home, if you would just snort it in your left nostril, a little bit way, about an ounce, and snort it in your left nostril, and within 15 minutes you'll feel exhilarated and very, very inspired, and the symptoms will all have gone. Will that be okay?
And doctor, before you go, and if the house, if this house is not COVID secure,
yes,
or COVID safe,
yes,
how likely is it that the neighbours will notice and report this?
Well, the effect of taking the suppository and also the cocaine will actually radiate into the consciousness of the people outside. So you'll find they'll become placid. That's the reverse effect. They'll become placid. They'll walk around in circles, which can be a little bit unsettling, but actually they will only walk around in circles inanely because the effect of you smoking the cocaine will rot their brains, and they will probably give me a call about something else which is called zombieitis, which occurs with people who have actually been in close proximity with people who have snorted cocaine and put suppositories up their bottom. Is that clear?
Thank you, Doctor. I shall let you get on, and I will pick that up in about 2 hours and 59 minutes from now. It has to be 2 hours and 59 minutes.
Very well, and I will have signed the prescription then. Come to the reception and take the prescriptions away and collect them today, and by the evening you'll be feeling absolutely wonderful and absolutely chipper.
Is 2 hours 59 minutes all right?
It is, yes.
Right. Okay.
Good. Thank you, Mr. Hines. I'll no doubt see you again later when you're your wife, you have a wife, yes, I believe, comes into me and explains to me that she's possibly pregnant because you've been impregnating her.
Right.
Which is one of the things that can happen after you have these particular prescriptions.
Yes, that's right. Yes.
Good.
Yes.
Excellent. Thank you, Mr. Hines. Have a very fine day.
Thank you so much, Doctor. Thank you.
Goodbye.
Thank you.
Thinking will be required to recognise that each of us within the community will remain proudly attached to our national identity and to the achievements of our national history and tradition. But at the same time, the environment of the community being clear beyond that, we recognize our common European heritage, our common European heritage, our common European heritage, our common European heritage.
Cameron, Brown and Claire. Not too much going on within their heads. Squabbling about the same old things, encouraging you in all of your sins.